So we're live on the YouTube, we're live on the Facebook, sadly not live on the Gram because I still can't do videos on the Gram, or at least live videos. I do pre-recorded ones, which I've just done, voicing my disquiet with the powers that be. But we will not be silenced. We will carry on the media that we have, and goodness knows the reach is enough on YouTube and Facebook for anyone. And I'm not sure if the servers could handle much more. But anyway, to all my loyal fans and followers out there, if you have any questions and you want to ask me that live, if anyone's there live, then please do. But I know you're busy, and I know that you'll probably come later. So if you're not able to make it, then just watch the pre-recorded bit, which I guess will be this, and I'll do it next week. But the ones I got this, so don't worry if you're not going to ask anything live, because I've got stuff to talk about. But if you have, it's nice to have live stuff. And I'll be honest, to give Instagram its due, I did have good engagement on Instagram, so I do miss it a little bit, to be honest with you. But it is what it is. We just got to work with what we've got. So let's do the questions that I've got, shall we? While we're waiting for everyone to arrive. What is the downtime for upper blepharoplasty? So downtime, right? Now the problem with that, the problem with blepharoplasty. So blepharoplasty is removing the excess skin from your eyelids, and the problem with it is that the skin is so thin in your eyelids, both upper and lower, that you do tend to get quite impressive bruising, because there is not much of a kind of a tamponade effect of kind of pressure on any bleeding. If there's a little bit of bleeding, because the skin's so thin, it can tend to sort of track, and you can end up getting a black eye kind of below your eyes, even though you've had surgery on the upper eyelid, and that can look a bit kind of alarming. So that's the main problem, I would say, with the downtime with blepharoplasty, because you often feel fine. The actual surgery of it is not like major surgery. There is a scar in your eyelid, but it usually heals really well. But the main issue is that you look quite dramatic, shall we say. So if you were doing work that didn't require you to be in front of anyone or to see anyone, you would be able to do that work effectively. I don't think you'd feel kind of ill. But if you are, that's why you see people with big dark glasses, who had surgery, seen come out of the Beverly Hills clinic with the big dark glasses. So if you are seeing anyone, then you might want to wear big dark glasses, and you will have bruising at least a couple of weeks, at least a couple of weeks. Even then, there'll probably be some yellowy and some, so it'll be quite sort of brown and purpley to start off with, then it kind of goes yellowy. So there'll probably still be a bit of yellowy even at a couple of weeks, 3-4 weeks maybe, until you kind of look relatively kind of not battered about. But you might be able to do work with a little bit of bruising. So I would say a couple of weeks would probably be average for people staying away from members of the public, unless, as I say, you want to wear sunglasses, or or you don't care that you've got a bit of bruising, because you'll feel okay, you'll feel able to do stuff. But it might be a bit difficult with the bruising. Good God, we've got a question. How hard is it to get arms done? I have skin hanging. Right, Mrs. G. It's not hard to get arms done, Mrs. G. But the problem with that, I always say to people, in terms of body contouring, if you're Googling, so when people are lost weight, there's certain areas that are a problem. The arms are a problem, the skin hanging, the breasts, the face, the tummy, the legs, especially the thighs. But if you're kind of Googling these sorts of body contouring surgery to tighten the skin, there's a disproportionate amount of stuff written about the face, facelifts, breast lifts, tummy tuck, compared to thigh lifts and arm lifts. There's not a huge amount about thigh lifts and arm lifts. And the reason for that is because the scarring is a bit more, or maybe even a lot more obvious with an arm lift and a thigh lift. With face lifts, breast lifts, and tummy tucks, we can kind of hide the scar. You know, face lift, you sort of hide it in front of the ear and behind the ear. Breast lifts, you hide it when it's hidden kind of in the bra, so you can't see it in the bra. Tummy tuck, we try and hide it in the underwear. But arm lifts and thigh lifts, you can't really hide it because the spare skin with an arm lift usually goes down to your elbow. And so whilst we would love to give you a short scar, often if there's a lot of spare skin, the scar goes down to just above the elbow, and that can be an issue if you've got short sleeves on. And sometimes people say, I hate my, I don't care about scars, I hate my arms, I can't show my arms in public. Well, if we give you a scar, you might hate the scar, and you might still not be able to show your arms in public because you hate the scar. So you've got to say, is it worth doing the surgery if you're going to have something that's cosmetically bad, and you're still going to want to wear long sleeves? Well, what's the point in having the surgery? So it is not as common. So I would say it's not kind of hard to get arms done, but it is not as common an operation as the other kind of operations. And certainly when I talk to people, I'm not doing, well, first of all, Mrs. G, I'm not doing these sorts of things anymore. I'm not doing the GA cases. But when I do talk to people about things like breast lifts, arm lifts and thigh lifts, I'm not very positive. Not because I don't want to do it, but because I want to give realistic expectations to patients, because I want to have a happy patient and I want them to be aware of what the outcome they can expect. And if I can kind of talk someone out of it, I'm okay with that, and I will show them photos of the scar, and we aim to hide the scar so you can't see it from the front and the back. It's kind of in the neutral position of the arm, but certainly if you put your arm up, you can see it. Same with your legs. When you're walking, it'll be okay, but if your leg sort of tilts to the side, then you can see it. So it is something that you might feel uncomfortable with, and so it might affect your decision on whether an arm reduction is for you. So it's really, in my experience and in my hands, arm reduction is really good for people who've got a really big excess of skin there, where it's kind of getting in the way and it's hard to find clothes, etc., because then it really will help to contour the arm. But in terms of its pure cosmesis, it has to be balanced against the scar, which usually fades, but it doesn't fade to invisibility. It fades to a kind of skin colored line, and it can take many months for it to get there. And even when it's faded, it can be visible, if you like, and you might kind of know there's something there. So I would say arms are not as popular as the other procedures. I don't think they're any more difficult to get. I just think they're not as popular because of the scarring. I think it's something that puts a lot of people off. And as I say, from a surgical point of view, that's fine if you're put off by it, because maybe it's not the right thing for you. Maybe it's it's a balance of like, what's the worst? So the worst of not doing anything is still having the skin, and the worst of doing it is kind of having a scar, the cost, the risk, the complications, the operations, the downtime, and all that. So that might be outweighed by the actual leaving it, so it might be a reasonable thing to leave it. It might not, you might hate them so much that you're happy to take on those negatives, but it's just about being informed so you can make an informed decision. It's all about informed consent. So you don't have it done and think, oh crikey, look at the scar, I wish I'd never had it done because I still can't show my arms and it's cost me all this money and I've got a big scar. We don't want that. No one wants that. So we want people to say, wow, that's brilliant. And to be honest with you, when you do it, patients are really happy. It isn't one of those ones where thigh lifts, anyway, I'm digressing a bit. Thigh lifts kind of less so. I find thigh lifts, personally, I find patients are perhaps not quite as happy, but arm lifts, I do find people are happy. But maybe that's just me, not very scientific sample size there, but that's kind of what I find. Good God, we've got other comments. Good God, human beings, Jackie's in the house. What are your thoughts on the reverse tummy tuck? Jackie, I've got very clear thoughts on the reverse tummy tuck. It is very, very rare to do a reverse tummy tuck. I think I've done 2 in my life, and I've done loads of tummy tucks. So it is very, very rare. So this is me, Jackie. You know, I'm not there, and I think there is someone, I think there's someone out there doing loads, and I don't understand what is going on, because I see people who said, "Oh, anyway, I don't know what's going on." So the excess in the abdomen in someone who has a problem with the contour of their abdomen is always, in my view, always the lower abdomen is worse than the upper abdomen. By the lower abdomen, I mean belly button down. Belly button down is worse than belly button up. People often say belly button up, I've got this I hate, but I've never seen, I think I'm right in saying this, I've never seen anyone who's got an excess excess abdominal skin without an excess lower abdominal skin. Maybe I should preface that by saying a significant excess upper abdominal skin. I've seen people who are really quite slim, who haven't got any excess anywhere, who are like, oh, look at this, I hate this. And when I bend forward, it all kind of bend, you know, it all like creases up. I'm like, well, everybody, when you bend forward, it all creases up. So, you know, but I've never seen anyone with a significant upper abdominal excess without an even more significant lower abdominal excess. So the first thing I would say, Jackie, is I personally have never seen anyone who I would consider a reverse abdominoplasty on before having had an abdominoplasty. So people have come for consultations for reverse. You know, someone rings up and said, I'm interested in a reverse abdominoplasty. I'm kind of almost like hoping they've had an abdominoplasty, because if they haven't had an abdominoplasty, I'm like, what's going on? What are you on about? You know? So so in my experience, a reverse abdominoplasty, if it ever comes, which is very rare, comes after an abdominoplasty. So as I say, the excess is pretty much always lower abdomen, and the abdominoplasty will address that excess, lower abdomen, belly button down. And it has, so often it's both lower and upper, but as I say, it's always worse in the lower. And I will always say to someone that the upper abdomen will get pulled down, and there's an indirect pull on the upper abdomen. So usually that is enough to tighten the kind of upper abdomen. And so you won't need a reverse abdominoplasty. The people who need a reverse abdominoplasty, in my experience, is people who've got have had significant weight loss and have literally got rolls on the, you know, a significant lower abdominal apron, but also a significant upper abdominal apron. So below the breast, kind of rolls of excess skin and fat, which will not be completely improved. There will be improved with an abdominoplasty, but perhaps not completely improved in abdominoplasty. And so those patients might require a second operation to remove those rolls in the upper abdomen, and that requires a reverse abdominoplasty, which gives a very large incision. And this is why it's not great. It's like a rooftop incision, so it's in the fold of the breast, which is fine because that's hidden, but it meets in the midline, so that's not hidden. So it's quite a big deal. You can get away with quite a big scar in the breast fold without seeing it, but as soon as you go across the midline, you see it. It doesn't matter who you are, you see it. So it does give a potentially more visible scar, and and as I say, it's usually not required. So we went through a phase actually. Well, it's probably because I've stopped doing it. We went through a phase with a run of people asking for for reverse tummy tucks, and I'm like, what's going on? And I think there's someone out there who's doing a load of reverse tummy tucks, and I'm like, what is, or at least anyway, maybe there's something I missed. So that's where I am. So I fully acknowledge that I might have missed something, Jackie, and there might be something out there that reverse abdominoplasties are a really good thing to do as a primary contouring of your abdomen. But in my world, it's not something that I would do. Well, never say never. You might see someone who think, oh, wow, you've got loads of excess skin in your upper abdomen and none in your lower abdomen. those people might exist in the world. I haven't seen everybody in the world, so there might be someone out there like that, but I've never seen anyone like that. The people I see have always got more in the lower, so they have a lower one first, and then once they've had a lower one, or a normal one, shall we say, an abdominoplasty, very rarely do they need anything more. Jackie, right? I'm going over, Lynn. I'll come back. I saw it on a TV program and never heard of it before. Okay, yeah. Oh, right. So you don't need. Oh, was that it? Yeah. So a reverse abdominoplasty is your upper abdomen. It's this bit. It's this bit here, as opposed to the tummy tuck, which is this bit. God, there's a lot there, isn't there? It's this bit here. See, nothing there, and it goes underneath your breast. So it's kind of like the same as a tummy tuck, but for the top of the abdomen as opposed to the bottom of the abdomen. But yeah, not common. Lynn, what you got? Hi JJ, what happens at tummy tuck consultation? Well, we assess you to see if you're a candidate for a tummy tuck, because that is weirdly, people with a good abdominal contour, or at least without a significant amount of excess, might not actually be a candidate for a tummy tuck. So people who are candidates for tummy tuck have a lot of excess skin, usually weight loss or childbirth. Usually they've had one or both of those problems, and they've got too much excess skin. So we need to assess you to see whether you are a candidate for a tummy tuck, and what sort of tummy tuck. So full or a mini. So basically, I guess you could do a mini on anyone, but you can't do a full tummy tuck on anyone because you need to have a certain degree of laxity. So some patients are actually more difficult if you've only had like one child or only a modest amount of weight loss and you haven't got a huge amount of spare skin. It might be like, crikey, I'm not sure I could even offer you a full tummy tuck. So we need to, so we might be then talking about mini tummy tucks and what that's involved, the limitations of that. So one part of the consultation is us assessing you to see what sort of tummy tuck you might be kind of eligible. Is that the right word? You know what we might be able to do for you. And then the other side of the consultation is kind of letting you know what that can achieve, what the risks of that are, and what the benefits of it are, to see whether that would be something that would be attractive and something that will be worthwhile doing. So as I say, this one side is us assessing you to see what we can do, and then we need to explain to you what we can do and what the benefit of that will be, and whether that would be a good thing for you to go ahead with. I guess in a nutshell, that's what's involved with the tummy. Is that so? What physically happens is we take a history and examination. So we talk to you, we say, what's the problem, what's what problems are you getting from it, what are what's your history in terms of weight loss and things, where are you with your weight. We need to make sure that you're stable and comfortable with your weight. It's not really good if you're still overweight. If you want to lose weight, it's not good to think about a tummy tuck. Past medical history, you got any medication, you're allergic to anything, have you got children, have you got any plans for the future for children, or weight fluctuations, are you happy with your weight? Because if you're not happy with your weight, you're better off getting your weight right first. If you think of having future children, it might be better to do that first because it could affect the result. And then we'll assess you and examine you and examine your abdomen and have a look at, as I say, whether you'd be a suitable candidate for it. So yeah, that's kind of what happens at a tummy tuck consultation in a nutshell. Zoe, what you got? Does lower blepharoplasty adjust mylar bags, festoons? If not, how can they be removed? Lower, oh yes, it does. So a lower blepharoplasty, Zoe, is a bit more of a thing than an upper blepharoplasty, because you've got to be a bit careful, and it's a little bit more nuanced, a lower abdominoplasty than an upper. Can I say abdominoplasty? Blepharoplasty than an upper blepharoplasty. So an upper blepharoplasty is kind of like taking out the spare skin from here. So a lower blepharoplasty, got to be a little bit more careful. There's not quite as much spare skin in a lower sorry, I've been talking about abdominoplasties. A lower blepharoplasty. Full disclosure, I don't do blepharoplasty, so I'm just talking general terms here. So I don't want to make out as if I'm the Billy Big Time here, because I don't do blepharoplasty. But anyway, I can talk about it anyway. So a lower blepharoplasty will have a modest amount of skin removal and will often be addressing the fat pad, which is what you're talking about. So mylar bags, so fat pad and festoons. You're talking maybe. So the problem with any kind of skin removal surgery, so if you have got festoons, if you have got a significant amount of spare skin, then more skin is needed to be removed, therefore the scars are longer. So that's the thing to consider. So the scar for a lower blepharoplasty is kind of in the line of the eyelid, but the more skin that we've got to remove, then that can extend out onto the side of the cheek. So we try and hide the scar, but it does make the scar a little bit more obvious. And again, the more skin that you remove, the more risk of a dog ear, a little bump at the end of the scar. So we try and make the scar, you get rid of the dog ear by making the scar longer, but you obviously want the shortest scar, smallest dog ear. So again, the more skin that is there to remove, the longer the scar. Often we look at the fat pad and we sometimes remove some fat, sometimes actually inject some fat, sometimes add fat into the lower eyelid. It is a bit more complicated and a little bit more nuanced, and is therefore requires a little bit more anesthetic. So it's not done under a local; it's either done under a GA or a local with sedation. So it's a bigger op, a lower blepharoplasty than an upper, and as you say, it often addresses more than just the skin. It often addresses the fat pad in the cheek area and in the lower eyelid area. So yes, so it does address those areas, and sometimes, I mean, it's I think it's got a little bit more of a kind of breadth of technique than an upper blepharoplasty. I think an upper blepharoplasty is more of a sort of standard what is done, and I think a lower blepharoplasty is a little bit more breadth of technique, and it could be considered kind of like a mid facelift. A lower, it's a lower blepharoplasty is often more than just like tightening a bit of skin in the lower eyelid. It often addresses the whole cheek subunit. So it often, it might be described as a mid facelift, but it's just to because you do have to address those things. Adele, what have you got, Adele? Can skin adenoma be left alone, or best removed in case of turning cancerous? No, it can be left alone. So I think you're talking about, is it sebaceous adenoma you're talking about, Adele? So presumably you kind of know that you've got this. So I'm assuming it's been biopsied, has it? So the thing about skin things, often with skin things, if you've got a skin thing and you think, what is it? Often the biopsy is, if it's not a big thing, we will remove it as the biopsy. That is the biopsy, and that's known as an excision biopsy, as opposed to an incision biopsy, which means taking a little piece of it away. Because often people don't like them, as well as being worried about them being cancerous. They don't like them. So, if we took a little piece of it away, say, good news, it's not cancerous. They're like, well, I don't like it. So if we can, and it's relatively easy, we'll take the whole lot away as the biopsy. So I don't know if you've had a biopsy already, but if you have had a biopsy and it's come back as benign, as I'm not sure about skin adenoma, maybe a sebaceous adenoma or some benign lesion, and you don't mind it, if it's not causing you any bother, but for sure you can leave it alone and just keep an eye on it, and just like you should keep an eye on any piece of skin. Doesn't necessarily need to be removed. The problem often with skin things, and I don't know what your situation is, Adele, but the problem often is, or at least sometimes, maybe not often, we will look at things and say, this looks like this or that, and we can get a pretty good idea, clinical diagnosis, pretty good idea, but you're never sure until you got it, got it off and looked at it under a microscope. So really, the most critical diagnosis is looking under a microscope, but you can get a pretty good idea just by clinically looking. And I guess you don't want to kind of remove every piece of skin lesion that's a worry. So if we have given you, or if a doctor's given you an idea that it's a benign lesion, then for sure you can leave it alone and just keep an eye on it. Zoe, thank you. Yeah, what we got? Yes, GP is examined and diagnosed as adenoma on skin. Okay, yeah, well, yeah, presumably it's not bothering you. And what I would say personally, anyone I was kind of seeing with a lesion who has obviously been concerned about it enough to see the doctor, is just say that keep an eye on it, look for changes, etc. But yeah, if it's clinically a benign lesion and it doesn't bother you, then you can leave it alone. And I'm just looking at my questions. I've got something about that, but I think it's a different question. And yeah, just keep an eye on it, Adele. Well, keep an eye on every piece of skin, but yeah, you can leave it alone if it's a benign adenoma. Thank you for participating, Adele. I feel bad saying that Instagram is good now because things are picked up. Do we offer Bullhorn Lip Lift Surgery? No. To be honest with you, I kind of know what is that what they call it, Bullhorn Lip Lift. I can understand why it's called that. I didn't even know it's called that, to be honest. But yeah, I know it's no. I know plastic surgeons do it. We don't do facial aesthetics really, so no, it's like you take a bit of skin out and like that. But no, I've seen it. No, I think because we could. It's just like taking a piece of skin out of the upper lip, but no, we don't. It's probably someone who does facial aesthetics is going to be better at that sort of thing. Sorry to disappoint. I have a mole. This is what I was thinking, Adele. I don't know what this. Have a look at what this question says. I have a mole that has been confirmed by the GP that it could be cancerous. I'm on the GP's waiting list for removal, but they said it could be a few weeks before I am seen. I'm very concerned and worried. How quickly can you make an appointment? Well, it depends on, well, actually, it doesn't depend. We're usually pretty quick for appointments anyway. By pretty quick, I would say, God, Amy should have given me some tips. I think a week, probably a week or two. We can see you pretty rapidly. We've got quite a few surgeons now. And so we should probably be able to see you within a week or two. Having said that, we've had a few recently. What we usually do, because we've got this see and treat service, we've got a sort of system where people will send us a photo, and that will, first of all, let us give you a price without having to come to see us, but will also give us an idea of whether it's a bad thing or not. Because we've had a couple recently that, well, literally 2 in the last couple of weeks, which have looked bad on the photo. We think that looks bad, so we will certainly, if it's a mole that looks like it's gone cancerous, you've got to be a bit careful because you've got to think about things like melanoma. There are other types like BCC and SCC which are less worrying, but certainly melanoma is a bit of a worry. So if we are concerned about melanoma, we will get you in, and if not on the day, in the next day or two, we will certainly get you in. And I've done someone a couple of weeks ago, and I know that Costas treated someone like last week, and both times we put them at the end of the clinic where everyone agreed to just stay on, but just because melanoma you kind of want to get off as soon as possible. So yeah, so if you send us a photo and we think it looks worrying, we will get you in very quickly. But if it's just kind of like, if it doesn't look that worrying, we'll still try and get you in quickly, but it'll be like a week or so. Because when you say your GP says it looks cancerous, there's different types. If it looks like a BCC or SCC, we can be a bit more relaxed about that. Yeah, they're normally like red, crusty, often sun-exposed areas, often in older people. So they're less of a concern. They can be left a bit longer than a melanoma, which is kind of a mole. So if it's a mole, if it's a brown mole that is concerning, I think it's reasonable to expedite that. I wouldn't say you really want to leave a few weeks before getting that off, because melanoma you want to get off as quickly as possible. So we would certainly do it less than a few weeks. We would probably try and do it within a few days. And as I say, the last couple we've done actually on the day, but certainly within a few days, because we try and help with that. So yeah, for sure, send us a photo. It's the thing to do. WhatsApp it. Don't know what the number is, but if you go on the website, can you do it on Facebook? There's a WhatsApp button on Facebook, isn't there? Anyway, if you go on the website, I think there's a button somewhere that says WhatsApp a photo or something. Can you remove a cyst from the scalp? Odd question. Can you remove a cyst from the scalp? Yeah. Why would you not be able to remove a cyst from the scalp? Yeah. I mean, cysts are lumps underneath the skin. So it kind of doesn't even matter how big it is. Even if it's a massive cyst, you just have to make an incision in the skin and then get it out. So yeah, because I'm assuming this question is because the skin on the scalp is quite tight. So you actually can't take out a mole or any significant amount of skin because it is quite tight. So if you have like a tattoo, we certainly have tattoos on the scalp, or a mole or something like that. If you had a big one, it would be difficult to remove from the scalp. But in terms of a cyst, that's subcutaneous, so we don't have to take any skin out with the cyst. Sometimes we take a little bit out if the cyst has tented up the skin and stretched the skin a bit, but that's only to close it without having loads of wrinkly skin. But yeah, there's absolutely no problem removing a cyst from the scalp. Well, the only issue that you might want to think about is that it will leave you a scar, and the scar won't have hair on it. So just to be aware of that if you've got short hair like me. Yeah, if you're completely bald, the bald bit will be all right. If you've got really long hair, it's all right. But if you've got short hair like this, there'll be like a line in it. So that's something to consider if you're having a cyst removed the scalp. But the doing of it is absolutely fine. Do cysts from the scalp relatively often. So yeah, it'd be fine to remove a cyst from the scalp. Can a mole be removed from one of these tattoos? Yeah, we had one of these a while ago, where the lady had a mole, quite a large mole, quite kind of like birthmark, and she'd had a tattoo to cover it, and the tattoo hadn't really covered it, so she could still see it. And I removed it. In fact, I've had to do it in a couple of ops. But the problem with that is it's going to mess up your tattoo. So it's going to give you a scar in the middle of your tattoo. So that's something we need to discuss, have a discussion on, because we'd have to take out that piece of the skin with if you've had a tattoo over the mole. But yeah, absolutely fine to remove a mole from under a tattoo. No problem at all. Perfectly doable as long as you know that your tattoo might be a bit mixed up. Do you have a lady surgeon at your clinic? I bet this wasn't a question. I put it to you, Amy, that you've planted this question. I can't believe, is this a real question? Because anyway, maybe I shouldn't, maybe we'll cut that bit out of the edit. Maybe that's not helpful, because we have got a lady surgeon who is starting tomorrow. I have reason to believe. So she's starting tomorrow. So Shine is starting tomorrow afternoon. I've got a clinic tomorrow, and then she's after me. She's sort of overlapping a little bit, but she's so yeah. So yes is the answer to that. We have got a lady surgeon as of tomorrow. So yeah, yeah. Well done, Amy. That's let's promote Shine. Let's all give a big hand to Shine. And that's it. I'm out of questions. I just realised I've got a lead. Is that okay to have product placement on the? I should get people to send me merch, shouldn't I? Now that I mean, look at this engagement I've had on this. Any T-shirt manufacturers out there or hat manufacturers want me to wear their merch while I'm doing this to promote them, product placement. I'm very happy to consider that. So just put that out there. So Levi's completely didn't get any. Just had to pay for this T-shirt, had to buy it and everything, which is wrong, really. A man of my social media reach, really, you'd think I'd have a bit more support from my sponsors. But anyway, as I say, I'm not going to grumble about it. I'm just going to push through. And if something comes to mind after this, if you're out there watching this and thinking, God, I need a question for him, and then and then a question comes, or if you're watching it on the replay, which I'm sure the vast majority of my followers are doing, since there's only hardly anyone. I don't want to take it away from you guys that have turned up, so I'm very grateful to you all. Post it in the comments, or email me, or direct message me, or phone me, or WhatsApp me. WhatsApp is going really well. since we started that WhatsApp button. It's a button on the bottom of the website that says WhatsApp. That has been really good, much better than the live chat. But anyway, yeah, by all means, WhatsApp. And and I'll do it next week is the thing. So next week, yeah. Without further ado, I am gonna take your leave, and I will say thank you very much, Zoe, Lynn, Jackie, Adele, all of you. For Mrs. G, who can forget Mrs. G? Started a ball rolling, Mrs. G, on YouTube, for participating in tonight's broadcast. Let's be honest, you guys are the stars of the show. I'm just here to facilitate things. So thank you very much, and I will bid you good night and see you same time, same place next Tuesday at 7 o'clock.